Some patients, such as children, the very elderly, and those who are very breathless may find it quite difficult to coordinate the compressing of the canister with the inhalation or holding their breath for long enough. In such cases, one can either use a nebulizer, which actually delivers a much higher dose which is unnecessary, and also continues to deliver the medication even when the patients are breathing out, which actually gives it an efficiency of only 50%. The medication can equally effectively be delivered by the aid of a spacer device. This is a common brand of a spacer device available in Delhi NCR area. Essentially, a spacer device is a plastic container with its volume approximately equal to your tidal breath, which is the amount of air that you can breathe in with one breath. This particular brand has a valve in it so that you can breathe into it as well as breathe in the medication. Most of these inhalers need to be fixed or put together as you would a mixer and grinder in your kitchen, and please see your doctor if you're not sure how to put it together. The inhaler, which I demonstrated a little while ago, would come into the receptacle at one end of the spacer device, and the inhaler would need to be shaken as we did if we were taking it directly. We need to uncover the mouthpiece cover, then we breathe out, take the mouthpiece in and compress the inhaler, and without worrying too much about the timing, we gently breathe in the medication mixed in the air within the container. If you're very short of breath, you may choose the technique of breathing in and out of the spacer device up to 5 times after just one compression of the canister. As with taking the inhaler directly, after you have breathed in the air, try and hold your breath for 10 seconds or as long as you can. And you still need to rinse your mouth or gargle and spit it out so that any steroid containing medication does not cause any throat irritation or thrush. I will now demonstrate the technique. If you choose the technique of breathing in and out of it 5 times due to being breathless, you do not have to remove it to breathe out, as the valve will prevent any breath breathed into the spacer device from diluting the medication. Please follow the instruction from the manufacturer about the care of the spacer device. What I would generally recommend is to just rinse it in clean running water, such as under the tap, once a week and letting it air dry. Some manufacturers recommend cleaning it with a very mild soapy water and then rinsing it off with clear water and letting it air dry. Do not put it in a dishwasher. Do not touch or rub the insides of this spacer device, as this would produce static and the medication would stick to the device rather than reaching your lungs. Normally, I recommend changing this device once every 6 to 8 months, or if the valve, which you hear as a click as you breathe in and out, if that becomes non-functional.